Hi, this is Corey Minter, and this is Chapter 1 in the Athletic Training class. This chapter goes over the athletic trainer as a healthcare provider. Athletic trainers specialize in preventing, recognizing, managing, and rehabilitating injuries. They function as a member of the healthcare team, which also incorporates and involves a number of medical specialties. They provide a critical link between the medical community and the physically active individuals. A brief historical perspective is in early history, evidence suggests that coaches, physicians, and therapists existed in Greek and Roman civilizations. They assisted the athletes in reaching top performance, much as they do now. The athletic trainers came into existence in the late 19th century in intercollegiate and interscholastic sports. Early treatments involved rubs, counter-irritants, and home remedies. The evolution of the contemporary athletic trainer includes a traditional setting of practice, which includes colleges and secondary schools. They deal exclusively with the athletic population. Today, certified athletic trainers work in a variety of settings with a variety of patient populations, such as what's listed there: professional sports, hospitals, clinics, and so on. The rapid evolution of the professional following World War I includes the Kramer brothers, which developed a line of products to treat ankle sprains in the 1920s. This led to the first publication of the first aider in 1932. In the 1950, the NATA, which is National Athletic Trainers Association, was recognized. Now, athletic trainers are becoming more aligned as a clinical healthcare profession. Because of this, it's important that we start making some changes in the terminology. Most time we refer to our patients as athletes. But technically, this should be called patients and clients. The athletic training room should be called the athletic clinic or facility. And we should not be called trainers. We're athletic trainers. As you notice here, sports medicine in the form of an umbrella. Now these items fall underneath this umbrella. On the left we have performance enhancement, which includes exercise physiology, biomechanics, sports psychology, sports nutrition, strength and conditioning, coaching, and personal fitness training. On the right side we have the injury care and management, which includes the practice of medicine, athletic training, sports PT, sports massage therapy, sports dentistry, and so on. So the National Athletic Trainers Association is what was mentioned before, the NATA. What they do is enhance the quality of health care for athletes and those engaged in physical activity, and to advance the profession of athletic training through education and research in the prevention, evaluation, management, and rehabilitation of injuries. The NATA now has 32,000 members and continues to grow. Some of the roles and responsibilities of the athletic trainer include injury prevention and healthcare provision for an injured patient. It also includes dealing with patients and injury from its inception, so when it first occurred, all the way through return to play. Roles and responsibilities of the board's certification domains. There's 5 domains listed, called injury and illness prevention and wellness protection, clinical evaluation and diagnosis, immediate emergency care, treatment and rehabilitation, and organizational and professional health and well-being. Next, we're going to discuss evidence-based practice. Now, evidence-based practice is what all medical professionals base their patient care off of. It's evidence driving patient care. Failure to engage in evidence-based care could jeopardize patient care. Some of the steps for evidence-based practice include developing a clinical question and then searching out that question through literature. Then you're going to appraise the evidence and then apply the evidence and assess the outcomes. Some of the personal qualities of an athletic trainer that are important to have to be successful is having the stamina and the ability to adapt. Practices are long. Athletic trainers definitely work long hours, and they're faced with many different challenges. So you have to be willing to adapt. You need to have empathy. You need to be able to feel what the athlete's going through and try to empathize with them through their injuries or concerns. It's always important to have a sense of humor. Athletic trainers are quite funny. We do work very long hours, and we need that humor to keep us going. Communication is extremely important. We need to be able to communicate with doctors, with coworkers, with athletes, with coaches, strength and conditioning coaches, with every aspect of the sports medicine team, along with parents. So we need to have that communication. Intellectual curiosity is an important one as well, as we need continuing education units to stay certified. We need to have that curiosity to continue learning new things and growing within our profession as medical changes constantly. Next is ethical practice. We need to make sure and always stay ethical, always have good choices and decisions in mind. And the last is professional memberships. Join the NATA. I know I joined that before I even got into an athletic training education program. It offers huge benefits to not only students but to professionals as well. So let's talk about the athletic trainer and the athlete. A major concern on the part of the athletic trainer should be the injured patient. All decisions impact the patient. The injured patient must always be informed. They need to be made aware of how, when, and why that dictates that course of injury rehabilitation. The patient must be educated about injury prevention and management, have instructions that provide regarding training and conditioning, inform the patient to listen to his or her body in order to prevent injuries. Now, the athletic trainer and parents, parents are really involved in a secondary school setting, so it's important to maintain communication to the parent of the injury management and prevention. Parents' decision regarding healthcare must be a primary consideration. Insurance plans may dictate care as well, such as the selection of a physician. The athletic trainer, the physician, coaches must be aware and inform parents of the Health Insurance Portability and Accountability Act, which is HIPAA, which regulates health information and protects the patient's privacy and limits people who can gain access to the medical records. The athletic trainer and the team physician is a really close relationship, as the athletic trainer works under direct supervision of that physician. The physician assumes a number of roles, and it serves to advise and supervise the athletic trainer. Physicians and the athletic trainer must be able to work together. They have to have similar philosophical opinions regarding injury management, and it helps to minimize discrepancies and inconsistencies. The physician is responsible for compiling medical histories and conducting physical exams, such as the pre-participation screening. They diagnose injuries, decide on disqualifications, and some of the physicians attend practices and most attend the games, especially like football games or high-impact games, basketball. They need to have commitment to the sports and to the athlete. The athletic trainer and the coach must understand their roles. The coach needs to understand each individual role within the team. As you get to higher up, like Division I, there's many players on a team, such as the athletic trainer, the coaches, sports and conditioning coach, the nutritionist. So it's got a wide variety of people, and the coach needs to understand everybody's role. Coach must clearly understand the limits of their ability to function as a healthcare provider. They need to, or they have the direct responsibility for injury prevention, such as going through an appropriate conditioning program. Coaches must be aware of the risk associated with the sport. They need to provide the appropriate training and equipment. They must be certified in CPR and first aid. And they must have thorough knowledge of skills, techniques, and environmental factors associated with the sport. They need to develop a good working relationship with the staff, including the athletic trainers. And cooperation is one of the most important. So, recognition and accreditation of the athletic trainer as an allied healthcare profession. In June 1990, the AMA officially recognized athletic training as an allied healthcare profession. There's a few committees before CATIE got involved, but the last one is the Committee for Accreditation of Athletic Training Education, which is CATIE, which is responsible for developing essentials and guidelines for the academic programs to use in preparation of individuals for entry into the profession. You'll hear a lot about CATIE once you get into an athletic training education program. They have helped to develop the athletic training education competencies. There's 8 content areas, which is evidence-based practice, prevention and health promotion, clinical examination and diagnosis, acute care of injury and illness, therapeutic interventions, psychosocial strategies and referrals, healthcare administration, and professional development and responsibilities. Now, the book goes more in depth on these areas, so it's important to pay attention to those when you read through them. So, requirements for certification as an athletic trainer. Guidelines are set forth by the BOC, which is the Board of Certification. Upon meeting the educational guidelines, applicants are eligible to sit for the exam, such as graduating from an athletic training education program. You can do that through a bachelor's or a master's. The exam is computer-based, and it's held at testing centers. The exam assesses 5 different domains, which is the injury, illness, prevention, and wellness protection, the clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and organizational and professional health and well-being. That's what all the different classes you take in the program will cover, those areas. Now, once you pass the BOC, you will be an ATC. That will be your credential. So you will be a certified athletic trainer. In most states that have licensure, the BOC certification is a prerequisite. Continuing education requirements. As I mentioned earlier, one of the BOC requirements is CEUs. You need to have, I think they moved it down to 50 CEUs every 2 years. It used to be 75 for every 3. That helps ensures ongoing professional growth and involvement. Requirements that must be met to remain certified, like I talked about. And you must have a professional rescuer CPR AED. You can either get that through the Red Cross or American Heart Association, but you must stay current on that. And then the last thing is the state regulation of the athletic trainer. Regulation may be in the form of licensure, which is the most restrictive of all forms of regulation. That's why California is trying to get it. We're one of the last states to have it. Well, we don't have it yet, but hopefully we'll have it soon. There's certification, registration, and exemption. So as you read over that in the book, read the differences between them. I think exemption, Hawaii is the only one that's exempt. But this concludes Chapter 1 lecture. It's fairly fast, fairly brief. And then we'll discuss more in class.